If you've been listening for a while, you might notice something. Some of these story episodes overlap a bit. You've heard parts of our story with Ellie in the early days. You've heard parts of our hospital stays. You've heard pieces of what life looks like now. And what I want to start by saying today is, yes, that is intentional. Because I'm not just telling a story in a straight line, I'm telling you something in layers. And depending on the episode, I'm zooming in on different layers of the same life. Sometimes I'm in the beginning, diagnosis, shock, early survival. Other times I'm in the middle, hospital cycles, ICU stays, respiratory viruses, tools we've learned. And sometimes I'm stepping all the way back, talking about identity, rhythm, advocacy, what it means to build a life inside something you didn't choose. So, if it feels familiar, it's because life in the medically complex parenting world is not linear. It repeats. But you aren't the same person each time something repeats. When Ellie was born, we were told she likely wouldn't live long, and in that kind of moment, everything compresses. Future, identity, time, fear, all of it gets pulled into one small space. 24 hours after giving birth to Ellie, I walked out of the hospital with my baby. No certainty, no roadmap, no real understanding of what was coming. And when we pulled into our driveway, there was already equipment waiting. Oxygen, supplies, machines I'd never seen. And in that moment, something shifted permanently. We weren't just parenting as usual. We were moving into caregiving as a system. The first weeks were not structured. They were survival. Ellie needed some oxygen support, but laying flat sometimes was unstable, so I held her upright on my chest night after night, 21 days straight of maybe 45-minute sleep cycles at best, and trying to get her to take any nutrients, but not really sure any of it was getting in her mouth. And I remember thinking very clearly, I don't know if I'm doing any of this right. So there's this particular kind of exhaustion that came over me. Loving someone so fragile and your body never relaxes. There were moments where I prayed things I never expected to pray, certainly not because of a lack of love, but from this utter lack of control. That is a place many parents in medically complex or severely disabled situations recognize instantly, even if no one talks about it out loud. When you enter this world, no one hands you a map, and often you don't know what questions to ask. There's a whole spectrum of care that exists between everything's fine and we're in a crisis. And most people only learn that as they move through it. At one end, low flow oxygen, nasal cannula support. Then you have your high flow oxygen, your CPAP, your BiPAP. Still, there's more supports and non-invasive things and manageable things at home. But then you get into things like intubation, temporary ventilation support, tracheostomies, surgical ways that children can live full lives, but sometimes with and sometimes without ventilators. And here is a part that I wish I'd understood earlier. Most of these things are not failure points. They are just tools, different levels of support for different types of needs. Knowing that changes how you feel when you hear the words, because fear thrives in the unknowns, but it often softens in understanding. When Ellie had her first hospitalization, I was really thrown. What I didn't understand yet is that medically complex care can be cyclical. Illness comes, stability returns, illness comes again. We saw that cycle repeatedly in 2022, mostly with rhinoenterovirus, but also with human metapneumovirus, and most recently in 2025 with RSV. Sometimes we'd go into the ER and come back home. Most of the time, if we went to the ER, it ended in a PICU admission. Over time, something started to change, not so much the pattern, but my response to it. We began slowly building what I now kind of jokingly call the HICU, the Home Intensive Care Unit system. Not because we wanted to replace the hospital, but because we wanted to extend care in our home safely and hopefully skip the hospital as much as possible. We learned to use tools like nebulizers and suction machines and CPAP and high flow and shake vests and cough assist devices. And what this created wasn't just a medical management system, it created time. It created options before escalation and time before crisis, time to stabilize at home, around family, whenever possible. And sometimes it meant avoiding the hospital entirely. Not always, but enough to matter. And I want to be very honest here about something. Sometimes you cannot stay at home. Sometimes the hospital is the safest place. And learning the difference between those two things is part of the journey. For us, that often looks like if Ellie needs more than our home system can provide, we don't try to stretch it further. We just go in, not as a last resort, but as an appropriate step of escalation. And then the distinction here matters because it removes shame from the decision. We bring a lot of our own things to the hospital so that they can be used in that context. And quite honestly, pro tip, that does make discharge a lot easier and often days sooner. Hospitals teach you quickly that nothing is static. Every 12 hours, a new nurse, a new doctor, a new perspective, a new interpretation, a new approach. Your role becomes the constant. You are the historian of your child. You know what worked before, what didn't, what usually escalates, and what usually stabilizes. Over time, something shifts in you. You will stop guessing. You will start recognizing. I did not start as a strong advocate. I hesitated. I doubted myself. I would assume I was overreacting. Sometimes that meant I stayed quiet when I should have spoken. But advocacy is not a personality trait. It's a learned behavior through repetition, through data you collect while you're living it. And through slowly realizing that you are not just a parent in the room, you are the person who knows the most consistent version of your child. Doctors know medicine across many patients. Therapists know systems across many bodies of work, but you know your child, not theoretically, practically. You know what normal looks like, what change feels like, what subtle shifts mean, and when something is coming. Even when you're new, believe me, you are still the person with the most continuous data set in the room, and that matters more than a lot of parents realize. One of the most important things I want to say clearly today is this. You are still allowed to live your life in the midst of all of this. There were moments when Ellie was in the ICU, but stable, and we would leave. We even went on a date one time with our parent-guardian bracelets on and everything. We ate a meal. We saw a movie. We sat in a different room and remembered that we are still people. And I know that sounds a little strange from the outside, but here's the truth. Sometimes there is a lot you can do. Other times, there's nothing you can really do in a stable situation when your child is doing well in the hospital at that moment. The best thing you can do sometimes is take care of your own nervous system and your relationships. You're not abandoning them. You're sustaining yourself so you can keep going. Now, at first, Everything feels pretty chaotic. No matter how you were thrust into this, no matter how much pre-existing understanding you may have had with this type of world for whatever reason, it's going to feel like chaos, like you're a paratrooper that just got dropped completely off course. But over time, you start to notice something. Rhythm. Rhythm in staying home. Rhythm in escalating care. Rhythm in the hospital cycles. Rhythm in recovery. And eventually a rhythm in how you build your life around and including and because of all of this. Not perfectly, but consistently enough to breathe inside it. And I also want to say something important about this space. It's not only my story. Over time, you will hear lots of other voices here, other moms, caregivers, families, specialists, therapists, people walking different versions of this road from different angles. Some managing feeding tubes, other respiratory support, some both, some navigating surgeries and therapies and rare diagnoses. Because there's no one single way to do this, and there's no one single child. There are many ways to learn how to care for your kid as well. And my hope is that this becomes a place where you hear, this is what worked for me, not this is what you must do. I want to leave you with this image, if you can picture this with me. A tree growing on the side of a cliff. No perfect soil, no steady rain. The wind is unrelenting. Nothing about this environment is easy, but still, it grows. Not because the conditions are ideal, but because it's just rooted there. You are like that tree. You found yourself planted in a hard place. But because you stayed, you adapted. And because you kept becoming and growing in the midst of it. You weren't made for this, no, but you are being shaped through it. And over time, you will realize something you did not expect. You're not just surviving your child's story. You are learning how to live inside it. And that becomes its own kind of life, one rhythmic cycle at a time. Before we close today, I want to make mention of some things that are practical. In the show notes for this episode, I'll include a few things that might be helpful if you're walking through something similar. Not because any of this is a prescription for your child or for your family, but because when you're new to this world, it can be incredibly hard to even know what to ask for or what to expect. So I will include things like what we typically pack when we do go to the hospital, what we bring from home when we come back from hospital stays to make life more manageable, and a few examples of the kinds of tools and supports we use on our day-to-day care at home, even things we use when we're escalating care but still keeping it here at the house. I'll include some simple outlines of our home sick day regimen routine so that when your child shows signs of respiratory illness, you know about some options you can ask your pulmonologist to walk you through. Things like airway clearance cycles, nebulizing routines, escalating care in a safely manageable way to stay out of the hospital when possible. Again, this is not protocol that you're supposed to follow. This is just real life examples of how one family learned their child and built a rhythm, something that can give you a starting point, a reference point, what you can talk to your doctor about, things that you can consider. Because that's really the goal, not to eliminate hospitals or avoid care, but to understand your child well enough that you can use everyday appropriate tools that are available to you at home when possible that you might not even know exist until you ask about them. Most of all, I want to remind you, you're allowed to learn as you go. You don't have to have it all figured out at the beginning. If no one has told you this yet today, you're going to find your rhythm in this. Maybe not all at once, but over time. And I'm really glad you're here, in the middle of it, learning how to keep going. This road is real. It's not easy. But you're still here, growing, learning, showing up. And I'm really glad to be with you.